News you can use.
Welcome to another edition of The Scoop, a program that is devoted to giving you news you can use about the resources available to you that you may not know about. Today, we are very fortunate to have with us Jodi Ray. Welcome, Jodi. She is the project director of USF's Florida Covering Kids and Family program. We appreciate your being here. Please tell us about the program and its history.
Florida Covering Kids and Families is an initiative that was originally started by the Robert Wood Johnson Foundation. It began in 1999 when the federal government first passed the state's Children Health Insurance Program, the S-CHIP program, at the federal level. At that time, they allowed states to design their own coverage programs for kids, public coverage programs for kids. And Robert Wood Johnson Foundation, what they did was provided grants to the states, and University of South Florida was a Florida grantee, to conduct outreach and enrollment activities to find these newly eligible children and help them get into the program.
When you say newly eligible, until that time, they were covered on Medicaid?
Up until that time, the only public coverage was Medicaid. These children, it provides coverage for children who are not eligible for Medicaid, nor do they have coverage through employer-sponsored insurance or private insurance. And so at the time that the legislation passed, we had well over 40 million uninsured children in the country. In Florida, we currently have an estimated 700,000 uninsured children right now.
I saw something that said 20% of Florida's children are not covered by insurance. Was that an old number? Is that what it is?
Those are based on census numbers. You know, census numbers are usually a couple of years dated, but the latest studies utilizing census data has the state at about 700,000. Well, we're continuously working to conduct outreach and enrollment throughout the state to try to reach those, kids.
Finding the kids, right, and letting them let their families know that this is available for them so their kids will be more healthy. Your program is broken up into 4 different initiatives, is that correct?
We have 3 different grants that provide resources to allow us to reach families through a range of avenues and networks. We work with the Agency for Healthcare Administration, we work with the Florida Healthy Kids program, and we also work with the Center for Medicare and Medicaid Services. And through those initiatives, we're able to conduct outreach to schools, we work with business partners, we work with, after school programs, we work with we do training, we work with HR folks. I mean, it's all kinds, and we work directly with families.
So you're collaborating with, just across the board, nonprofits as well as other agencies and so forth?
That's correct.
Now, so are all the children up until what age are covered, and how are they covered? What are the different programs they could get involved in?
Sure. Well, we call our coverage program Florida Kid Care. That's our coverage program in Florida. Every state has a similar program that's made up of the Children's Health Program, Insurance Program, and Medicaid. And some of them they design differently, and they have different names. And we call ours Florida Kid Care. And under Florida Kid Care, we have 4 parts. We have the Children's Medical Services, that covers kids with chronic health care conditions through age 18. We have the Medicaid program, Children's Medicaid program, which is children are eligible based on income eligibility for Medicaid. We have, and that's through age 18. We have the MediKids program, which covers those kids who would not be eligible for Medicaid, but those are the 1 to 4-year-olds that can get enrolled. And there is no income cap for those kids, so they can be up to any income, they can get coverage for the 1 to 4-year-olds. And then you have the Florida Healthy Kids Corporation, which covers children who are the 5 to 18-year-olds, the school-based kids. And again, because there is no income cap, we can get kids of all income levels and get them covered if they're uninsured.
When you say the 1 to 4 years old, I was just wondering, does that cover their immunizations and so forth that they're going to need for school?
Well, the great thing about the Florida Kid Care program, and this includes all the parts, is we say that Florida Kid Care covers checkups to transplants. So it covers things like preventive care, immunizations. It covers, just sick child visits. It covers emergency care, hospital visits. It covers things like transplants and severe cases like, all the way up to, cancer and, diabetes, chronic health care conditions. It covers dental, it covers vision, it covers prescriptions. So it is very comprehensive in terms of health care coverage for children and their need to access health care services.
Vision was one of them too, right? I'll bet. Okay. Do the parents of these children have to pay anything at all, or is it zero for them?
For most parents, most parents who sign up and enroll pay nothing, or they pay up to $20 a month per family, depending on their income eligibility.
Per family, not per child?
Correct.
Okay.
So it's based on the household size and income. That's how they determine eligibility. And if they have to pay more, if they're at a higher income, then there's the full pay option. And for a Medikids program, that's about $159 per child per month. And that includes the same coverage, the same co-pays that the children who have the $15 or $20. They also have no deductibles. Doesn't matter what their monthly premium is. And for Florida Healthy Kids, it's $132 per child per month. Also, no co-pays. Minimal co-pays and no deductibles to meet under that.
How can they access it?
Well, the easiest way to access it is they can go on the Florida Kid Care website, and there's information on there about the program, and that's at www.floridakidcare.org. And on the website, there's a lot of information about the program. There is also a link to apply using the web application. So they can sit at their computer at home, in their own living room, in a library, with a partner. They can apply and submit an application without ever having to
Stand
leave.
on a line, go
No,
anywhere,
that's right.
pay for gas,
That's exactly right.
take 4 buses,
Yes.
whatever.
Yeah, they don't have to do
Because
that.
those things are complicated.
Transportation can be an issue when families need to find assistance. So it's very user-friendly. That's one way. They can also call the Florida Kid Care customer service, which is 1-888-540-KIDS. And they can get a lot of general information. They can also get an application sent to them. They can fill out a paper application and mail everything in. They can get a paper application and just fax it in, so they don't actually have to mail anything in. But if they need assistance with applying and they need more information, we have partners all over the state. We have partners in communities that are working with diverse communities and diverse populations that can speak multiple languages, that can help the families, in their language that is most comfortable for them. They can help the families through the application and through the application process so that we can ensure that families don't get caught up with any, challenges or stop the process in the middle of it. We want them to finish and complete the process and get those kids covered, and we have folks that can assist them with that.
Does it work like an HMO in terms of, will I get a list of the doctors I can go to or take my child to, or the hospitals that we can go to, or do you go anywhere you want?
It does. It works like you would use your employer insurance. When you come into a job, sometimes they may have more than one health coverage plan that you have to pick.
Right.
So in every county, we have at least no less than 2 plans for a family to choose. They're not the same in each county, but they choose one of 2 or 3 health plans, and they're insurance plans, HMOs. And they get a network just like they would if they were getting a job, and they get an insurance card just like they would at a job, and for the HMO, and it's a network of doctors. Most families, we recommend that they choose a doctor based on the providers they want to use, the physicians that they need to use. They may call their own physician and find out which of the plans they accept when they're signing up so they know which plans they want to choose. And it includes specialists, a network of specialists, and it also, they do the same thing with their dental care.
Do they find out about these programs through the schools at all, or they can hear about them or see them in the newspapers? I suppose is true too. But right now we're headed back to school, and I was just wondering whether or not there's a big campaign for that, and do you do that every year?
Well, back to school is the busiest time of year and the best time of year for us to reach families, because families are thinking about these things. This is the kind of stuff that's on their mind. You know, what do my kids need to be ready for back to school, to start school? And for some of them, it could be, you know, thinking about joining athletic programs, for example. So athletic programs will require, you know, either, you know, having had a physical, certain immunizations are required going back to school. So all of these things are on parents' mind, and it's a great time to get their attention. We always say, sign your kids up for health insurance on their back to school checklist, because, you know, while you're busy getting things like, you know, the clothes that they need and the shoes
And the crayons.
and yeah, and all the supplies, this is why we work with these kind of partners. We work with a lot of businesses during back to school. We have folks out in the community at health events and school fairs, and, you know, they're getting their backpack, and they're also, you know, invited to sit down and, okay, while you're getting your backpack and your back to school supplies, let's sit down and make sure your child has health insurance too, so they're all set for what they need. And so we do a statewide campaign, and we work with these partners all over the state. Usually there's well over 200 events where we have kid care partners. And when I say kid care partners, I mean we have people from businesses, from community-based organizations, from faith-based organizations, working in the community at these events, reaching out to families to help them sign up. And so the back to school time is really a key time.
I read somewhere that it used to be, or with some programs, it's pretty complicated what you have to do to fill it out, but that they made it easier in Florida.
Right. We've worked very hard. Myself and the Kid Care Partners have worked together very collaboratively to continue to find ways to make it easier for families. I mean, we get a chance to spend a lot of time working with families because of the work we do, and working with the folks in the community that work one-on-one with families, you know, that provide other services to families. So we, you know, get a chance to see how the families are using the information we're providing and using the application, and maybe what barriers we see occurring that may make it more difficult for a family to complete enrollment or keep coverage. I mean, a big thing we need to do is remind families that once they have coverage, they need to keep the coverage. They need to renew their coverage on time. They need to continue to make sure that they're paying their, you know, monthly premium payments, because keeping the coverage is important too. And that tends to be a bigger challenge as the kids get older, because like you said, when you're dealing with immunizations, and the elementary school kids have there's a more frequent requirement to having certain shots going into school. So
when you get to junior high, they don't really ask anymore.
Right. So it's more, you know, parents are finding themselves, you know, they more frequently have to see a physician that they're required to. So as the kids get older, we see a bigger drop for the older kids, the high school kids and the older middle school kids. So really, you know, reaching out to parents of adolescents and teens is a big challenge, because we need to make sure that those kids are keeping their coverage. And we know that teens and adolescents have, you know, much more unique healthcare needs than the kids that are in elementary school. And so we have to continue to find ways to do that. One of the ways that we do that is we work with athletic programs. So we've been engaging school athletic directors, community sports programs, and also the professional sports teams have been getting involved to reach families, because all of them serve a role. They're mentors, they're coaches, they're trusted community folks.
And they can see maybe a health problem coming up frequently or something where someone really, the kid really needs to get a doctor.
Well, and you don't want a child on a sports team run into a situation where they get injured and then they don't have access to a physician and you know, the services they need to recover.
That's true, and that's more likely when you're in adolescence or being a teenager than it is when you're a little kid.
That's right.
Where you have just different needs going on.
That's right.
You mentioned earlier that also you have this program that covers kids that have a chronic illness. What are some of those? I know you mentioned diabetes as one, but I was trying to think, well, what are they?
Well, the Children's Medical Services Program, which does cover children 0 through 18, deals with, it provides coordinated care for kids who have needs, healthcare needs, behavioral healthcare needs, emotional healthcare needs that are beyond, say, the average child. And that can include things like asthma or diabetes that require more need for services. So it may not be necessarily always so severe, but it may include things like, cancer, needs for, very severe healthcare needs, heart conditions. So the range is huge depending on the child's regular need for services. I mean, it could be mental health care services as well. So, it depends on what they need and how frequently they need to obtain services. And a care coordinator works with the family to make sure that the child service providers are they're communicating and that care is being coordinated for the child in the best interest of the child.
Is there like a caseworker on those kinds of
It's
children?
a care coordinator nurse with
Okay.
CMS. And we have CMS nurses in every county in the state that works with these families to make sure that they're appropriately utilizing their services and getting their services as they need them.
The program used to just be called Florida Covering Kids. Right now it's Florida Covering Kids and Families. So does that mean it got expanded to help others besides the children?
Right. Originally, when the S-CHIP program passed in 1999, actually it passed, the program passed before that at the federal level, but the Covering Kids and Families initiative started in 99. Mm-hmm. It was called Covering Kids because when S-CHIP passed, it was funding to enroll children only. Okay. And then in, I believe it was 2002, they expanded to cover other adults that would be eligible under the income guidelines if states chose to do that. So some states did expand their coverage programs to cover other adults that could be eligible under the income guidelines. Florida didn't do that, so we weren't covering adults under CHIP, but that's why they changed the families to Covering Kids and Families.
Because it's going to be available to them. Now, they reduced the amount of paperwork that is needed for you to enroll, and you have all this help for people so that they can come in, they can call, they can get people in their own languages so they can really be helped a great deal with all of that so that it's not an issue of being too complicated for them, correct?
That's correct.
And because that was probably a drawback to some of this, because I noticed that in other things that people are eligible for, they either don't know about them, nobody's telling them about them, or it's just going over their heads and they're just missing it, or it becomes such a burden that they just don't go through with it, and that could create a big problem for them.
Right, and it's still an ongoing challenge for us. Making families aware, just making families aware of the program is a challenge. There really aren't a lot of resources to do things like marketing and awareness campaigns, for example.
No, we taxpayers don't like to see that word, marketing. Oh, what's the government doing? Or what are people doing? Right.
But
which is silly, because that's really educating people. Right?
That's right. I mean, from our perspective, our goal is to make more families and reach as many families as possible with this information that a program like this is available for you and your family. And so without those kinds of resources, we really rely on the work that's being done at the ground level, the grassroots level, the word of mouth, parents talking to each other, community, making sure that we have enough community partners and businesses that know that this program exists, that understand how to assist families. Because I can't assist 700,000 children or 500 and some thousand children that are eligible myself, and I don't try to do that. But it requires that we have enough folks around the state that know that enrollment is open all year round, that we have room in the program for more children, that the need is there. So we want to make sure our community stakeholders know that we have something that can help your community. The issue of uninsured children has such a domino effect on so many areas of community. I mean, it affects safety, it affects academic success, it affects, health, the health of the community. So it has such a huge effect that is so much broader than just the immediate family that's affected by not having their child enrolled. I mean, we know that, for example, parents of uninsured children have more absences from work than children who have of parents who are insured.
Right.
So it's important that employers make sure that they have fewer employees with uninsured children. It's to their benefit.
To their benefit to keep their employees working
It's a
and not
fiscal
having to stay
impact.
home with their sick child if they had gotten them well quicker.
That's true. And even when you think about it, even if the parent does show up, a parent who has a sick child at home is not really paying attention and they're not focusing on their job when they do show up. So, a child who has access to preventive health care, the parent doesn't have to worry about whether they can get their child into health care services and a provider when they need it, is more focused on their job. So it's a benefit to employers and to businesses. And we work with the sheriffs and the city police because they know that when they show up, children who are not well, who are not physically able to get into a physician, I mean, it has a safety issue. So they're partnering with us. They can identify a child that maybe isn't getting regular health care services, and they can help the family and direct them to applying for this coverage. So, we have all sectors of the communities involved in this effort.
Now, with our economy being in the problems we're having now, and we're still in Florida, at 10% or more unemployment, are we seeing a rise in the need for this program?
Absolutely. Well, there's a couple of things that we see. And one of the things that we see is that we have people seeking out these kinds of programs that have never had to seek out programs like this before. And they're not familiar with what kind of public programs are even available to them to assist their families. I've helped families that were one time, maybe had 2 cars and a large home and 6-figure incomes that no longer have those things and don't have access to health care coverage for their kids. So we have to help them not only understand that these kinds of programs are available and how to apply for them because they've not done that before. So we have that. We've seen a rise in applications just because of the changes in the economy. We have seen our enrollment going up in both, the Medicaid parts of the program and the other parts of the program. Enrollment continues to rise because there is a greater need. Unfortunately, because we have continuously more people coming into the uninsured pool in Florida, it's really hard to make a dent in those numbers when you're working against the tide that way. So even though we're seeing enrollment go up and we're seeing massive amounts of applications come in, there's just still so many more people that are eligible.
What are the qualifying things to get into these things? Like, is it poverty level, family of 4? What does it take? And is it last year's or right now? Because when you say somebody who could have been making 6 figures and then suddenly loses their jobs or their company goes out of business, then immediately they have a problem because they just lost their insurance and so forth. So what kind of criteria does it take to actually get approved?
Well, the good news is we base it on what your income is when you're applying.
Okay.
So yeah, maybe your income was this, but now I'm applying and I have nothing. I have no income, or it's been cut in half. Well, that's the income you're receiving, and so that's the income. And they look at, they ask for things like maybe your last 4 weeks of pay or something like that.
Your pay
so they
stub?
Exactly, and they try to get the most recent income information if possible. The state is also doing electronic verification of income. So it is possible to verify your most recent income right then and there as you're applying. So that's helpful. That works particularly if you're working for an employer, but not so much if you're, say, self-employed.
Okay.
If you're self-employed, you report what your income is, and there are other factors taken into consideration when it's a self-employed person applying. The income, a good example of families that pay no more than $20 per family per month, is at 200% of the federal poverty level. So for a family of four, example of that, it's about, I believe, it's somewhere around 44,200. Yeah, give or take a couple
A
$100.
family of four, that's
based
poverty
on-
level.
That's 200% of the poverty level.
Okay, right.
For a family of four. At the 2011, it changes, and every year that's updated. So they would base it just on that, on the current poverty level that the federal government sets. And, you know, the income level of the family goes up as there are more people in the family. So if you have a family of five, it's a higher income level. A family of three, it's slightly lower.
If you do exceed by a little bit that 200%, then that's when you start to contribute to the program, correct?
Correct. And I would never.
So
one
if
of the
somebody
things-
was making 50,000 with a family of four,
Right.
okay, they could be watching the show and say, "Oh shoot, you know, I just missed that. I'm making two," but they're not. They can still apply for the program and get the insurance at a much lower rate than they would in the marketplace if they could.
Right. Well, here's what I usually tell families. I tell families, first of all, they should apply and they should let the state determine eligibility, because there could be other factors that come into play. You know, they may look at, for example, the family may have daycare expenses, or, you know, one of the adults that, you know, income earners may be going to school. So there are a couple other factors that could adjust
okay.
it either way. So a family should never decide that they're ineligible or they may not qualify at a certain rate. They should apply and let the state do the calculation to determine their eligibility. The other thing that's looked at is if there are fluctuations in income. You know, we have families that are teachers that don't work during the summer, so they sometimes may not even earn an income at that point. We have people who have jobs that work on commission, that the income fluctuates. So all of that is taken into consideration and is part of the process. So families should apply
They
and
shouldn't
find
look
out.
at that last number. They
They should not deem themselves ineligible on their own, ever. But you're right. According to the eligibility guidelines, even a family that may seem or may come across after the eligibility is determined as too high an income for that lower premium, they can apply at a higher premium and they can still get the same coverage, and they still don't have to meet deductibles.
And they're still paying way less than they would have had they gone out into the regular marketplace.
Well, that's what
Because-
families report to us a lot. We have high participation in what we call the full pay program, and that's because they still find that they're paying out of pocket for this program so much less than they would pay for maybe private insurance.
USF administers the program for the entire state, correct?
Our program at the University of South Florida is a statewide initiative. We have 16 local coalitions across the state that covers more than 20-some counties. Like I said, we work with schools, school districts. We have community partners in 25 areas around the state. And so this initiative is statewide in terms of everything that we do, which includes the Tampa Bay area.
Thank you so much, Jodi, for coming, from the project director for USF's Florida Covering Kids and Families program. Please investigate that for yourselves and your children and your neighbors and their children and so forth, so that we can get a healthier state of Florida. Appreciate your being here. Thanks so much. We'll see you next time.
News you can use.